And now I'd like to introduce Dr. Michael Spear. He is the past chair of the Texas Collaborative for Healthy Mothers and Babies. Dr. Michael Spear is a professor of pediatrics and medical ethics at the Baylor College of Medicine. In that role, Dr. Spear is a full-time practicing neonatologist at the Texas Children's Hospital since 1976. He has published widely and has given more than 240 invited presentations. And he has served in leadership roles on the boards of the Texas Medical Association, the Texas Pediatric Society, and the American Academy of Pediatrics. He has served on the executive board of the Texas Collaborative for Healthy Mothers and Babies and the Gulf Coast Blood Center. He has received several awards and has been recognized for his leadership from the Baylor College of Medicine and the Texas Pediatric Society and the National Perinatal Association. He lives in Houston with his spouse, Mary, and 2 cats. Dr. Spear, it is great to have you here today, and I will turn the podium over to you, sir.
Thank you, David, and I wish to add my welcome to yours so far as the audience that is participating. Yesterday, we had a wonderful and amazing presentations and a wealth of information. Through data presentation, we see that we have made improvements to quality of care, but there are still many opportunities for additional developments to improve outcomes and to save lives. We heard from the patient panel who generously shared their experiences so that we can incorporate those into improvements of quality and systems of care. Through strategies outlined by our keynote speaker and through the patient shared decision-making training, we were able to learn strategies that will help us understand how to provide patient-centered care. And today, we continue our journey as we learn more about some new services under the Healthy Texas Women's Program, how to incorporate voices of patients and families impacted by disparities in quality improvement projects, and quality improvement opportunities for postpartum preeclampsia and critical congenital heart disease. So now I would like to welcome back Dr. Epps, the chair of the Texas Collaborative for Healthy Texas Mothers and Babies, and Dr. Rashmin Savani, the vice chair of TCHMB. Take it away. Thank you all.
Welcome back, everyone. Apologies for the brief moment to turn on my camera. So Dr. Savani and I are really excited to get to recognize all of the hard work from our participating hospitals and communities. A key role of a perinatal quality collaborative is to work to improve outcomes for mothers and babies in our state, and it depends on active participation and contributions from our participating hospitals and clinics. And the sharing of experiences, strategies, and barriers helps to make us improve not just at one hospital or one clinic, but overall at a state level. So all of the hard work done by these hospitals that we're about to present really magnifies the impact that we can have as a state on improving health outcomes of women and babies. And I'm going to turn it over to Dr. Savani.
Well, thank you, Carrie. Absolutely terrific. As you can see by the timeline, in 2019, the Texas Collaborative for Healthy Mothers and Babies entered into a partnership, an amalgamation, if you will, with the perinatal care regions and the Regional Advisory Committee Alliance, so the RAC-PCR Alliance. This partnership was really critical in engaging the entire state. And together with this partnership, we've been able to leverage our structure to engage even more hospitals in the QI projects, as you'll see in a few minutes. We've gone from 3 to 10 participating hospitals in the past projects to now over 150 participating hospitals. It's quite a dramatic exponential increase because of the integration of the entire perinatal care region structure. Everyone from the TCHMB Executive Committee, staff, committee members, project work groups, stakeholders, hospitals, funders are all really working together to become a state collaborative with a unified vision. Next slide, please. One thing that we have learned is that the participating hospitals and clinics really go through numerous activities as they implement and share best practices. And we'll be talking about these two projects in a second. But these activities include setting up data use agreements, assembling an internal team to work on quality improvement activities, implementing quality improvement activities within their hospitals and clinics, getting buy-in from a lot of stakeholders. They participate on regular calls and share experiences with the projects. We've had examples of hospitals helping other hospitals who are struggling with one or other aspect of projects, submitting the metrics and qualitative information on an ongoing basis, interpreting performance on metrics and identifying and implementing improvement strategies. And as I just said, mentorship to other facilities has really been one of the most remarkable things from what we've seen. For all their hard work and efforts and for their contributions towards the improvement of health of mothers and babies in Texas, we really want to acknowledge the hospitals and clinics who participate in the past and current projects. Certificates acknowledging all their contributions for participation will be sent to these hospitals. And what we'd like to do now is sort of go through individual projects, the neonatal projects in particular to begin with. And as you'll see, we'll have a scrolling of all the hospitals that participated, because we think it's really important to recognize the hard work that all of us are putting into these projects. So next slide, please. The neonatal projects include first the breastfeeding and human milk use in the NICU project. The purpose, if we could go to the next slide, please. The purpose of this learning collaborative was to increase the number of very low birth weight babies who receive human milk, preferably their mother's milk, as the primary source of nutrition to assist their immune system, gastrointestinal tract development, and decrease necrotizing enterocolitis. More specifically, this project was focused on helping participating hospitals identify and overcome barriers to establishing maternal milk supply and to support breastfeeding in the NICU. So we'll go to the next slide. And as you can see, this is the newborn admission temperature. This has an enormous number of hospitals that are participating. So kudos to over 150 hospitals. I could stand here and applaud you all for all day long for the hard work. The goal of this project is to implement evidence-based guidelines to increase the proportion of newborn infants with admission temperatures that are within normal limits. The broader goal is to increase newborn health care, quality, and patient safety. The initiative will be supported through the RAC PCR Alliance, and hospital participation in this project will provide additional metrics to inform quality assurance and performance improvement programs to support levels of care designation. I just wanted to give a little more detail into this. This was a project that was initiated in the North Central Texas PCR region, and it was incredibly successful. It's a project that all of us can relate to, because having babies have temperatures within normal limits actually directly translates to improved outcomes, fewer morbidities, and certainly even lower mortality. So in setting up that project that was sort of the initiation project in the North Central Texas region, we were unsure as to whether this was going to work. So we limited the amount of data that we were going to collect. With the intense focus that TCHMB is giving in terms of race and ethnicity focus and bias in our outcomes, When we translated this project to the statewide level, we were very, very careful in improving that initial burst of activity, and we now have race as a part of the data collection. As many of you have seen in your RAC-PCR committee meetings, we will be sharing these data. Initial data do suggest that there are differences by race, and as we get more data collection, we'll be able to really hone down on these differences even more. I just want to also mention that this is the largest QI project ever conducted in the state of Texas, and I think that that's an entirely a function of the combination of TCHMB with the RAC-PCR Alliance and enormous enthusiasm throughout the state for really setting up something that we can make a difference in the outcomes of mothers and babies. I'm now going to hand it over back to Dr. Epps. Carrie.
Thank you, Dr. Savani. So now we're going to turn to recognizing our participating clinics and hospitals under the OB and community committees. And we had 3 earlier projects. As I mentioned yesterday, if you were able to attend, we're going to talk about later on in the session an upcoming project from the OB committee. But the first project our obstetrics committee worked on very early on was reducing failed induction of labor. And the goal of this project was to reduce the incidence of failed labor inductions resulting in C-section and improve the overall process surrounding induction of labor. And we wanted to take this moment to thank the 3 participating hospitals. And of course, now we know there's a lot of focus on reduction of primary cesarean. Our community committee worked on improving access to reproductive health care via the One Key Question project, and we had 3 participating clinics. The goal of this project was to provide the necessary education, improve communication for women of reproductive age, and link them up to their desired services, including contraception, preconception care, well women services, and other resources, using the One Key Question protocol, which was designed by the Oregon Foundation for Reproductive Health. And then our obstetrics committee began working in partnership with the overall AIM, Texas AIM project on maternal early warning systems. The goal of this project is to implement a response system that includes a protocol with designated vital signs for recognition, alert, diagnosis, and treatment for women who are at risk of developing critical illness, with the goal of reducing morbidity and mortality. And I do want to acknowledge that there are many hospitals in the state that implemented maternal early warning systems via work with Texas AIM. These are the 15 hospitals that really worked in a learning collaborative, reported data, and gave us an idea of what this might need to look like for the larger group. So they really dedicated extra time. So we want to again thank the hospitals and clinics that have been participating, and we'll be sending certificates to each of you to say thank you, and they'll be emailed all the hospitals that we have listed and clinics. So please join me in thanking our hospitals and clinics.